Monthly program center stage featuring impactful cooperative extension-led programs at the local, regional, and national levels. I'm Kelsey Buckler, the Impact Collaborative Assistant with the Extension Foundation, and today you have an opportunity to learn about the Excite program. So I'm pleased to introduce today's program team leaders. We have Katie Stouffer from the University of Florida, and fellow Extension Foundation colleague of mine, Carl Bradley. I will post both of their bios in the chat. Go ahead and take it away, guys.
Well, that was a wonderful introduction. So excited to see all of you today, and excited to be part of this new Extension Foundation initiative. Wanted to start off because we might have some folks who are not as familiar with Excite. And so we have a quick poll, or two polls actually. Let us know if you are here as part of an Excite team, whether that's A1, A2, or not at all. Excellent. Some of you are not at all. I love it. Glad to have some folks from outside. In fact, looks like, wow, almost a majority of us as these numbers roll in. Fantastic. Well, we're really glad to have you here. And hopefully I will pitch this presentation appropriately, give you just enough background, but we are going to have some Q&A at the end. So feel free to drop any questions in the chat as you go. I can sometimes see them and respond and try and adjust, but we'll definitely get to as many as we can at the end. And Kelsey, you want to go on to our other poll then? You might have to flip. Yeah, so what's your role in Extension, or if you drag it down a little bit, if you're from a healthcare partner, maybe, or if you're from an NGO or government, just let us know who all's here. Because hopefully we'll show you how this can fit in any of your programs and any of the work you do, and have you potentially partnering with us if you're not already part of this effort. So yeah, great. Looks like we've got some people from a number of different areas. Okay, those of you who said other might feel free, if you would tell us in the chat, what your involvement is. It'd be great to hear a little bit about, why none of these that we chose fit you, and tell us who you are. So that's fantastic. All right. Well, Kelsey, I think we can go ahead and end that poll. I know some people are still joining us. Yeah, so folks from quite a few different disciplines. We're really glad to see so many different folks here today. All right, well, let me get started with my presentation, and I guess I need to share my screen first. And then, whoops. That's interesting. Oh, maybe if I just share the desktop and then go, there we go. Everyone's seeing my slides, right? Fantastic. Always an adventure. 2 years into doing everything by Zoom, and I'm still wondering. Well, welcome everyone. We're talking today about Excite, which is the Extension Collaborative on Immunization, Teaching, and Engagement. You can see that we managed to do a typo in our own slides. Whoops. But collaborative, luckily they're the same kind of idea. And we're just thrilled to be here today to tell you about this great program and all the great work that many of you have been doing. So you're probably seeing these controls and stuff too. Let me hide those for you. Is that better? Okay, great. So Excite was founded as a partnership among several groups. So many of you know Cooperative Extension and Extension Foundation, our land grant partnership with the federal, state, and local governments, and then Extension Foundation, which is a overarching organization that's supporting all of our efforts at our 112 land-granted institutions across the country. Of course, NIFA, a major part of that. This particular program was funded actually with a joint funding agreement between NIFA and the Centers for Disease Control and Prevention, CDC. They gave us $9.9 million or through Extension Foundation to do this great work. And so we're going to tell you today a little bit about what that's looked like. This is the project team, many of whom are not here today, but I am the assistant project director. See me here. Carl is our team development and leadership lead. And then so many other people. Melanie is here as our communication and technical assistants today, and is really helping get a lot of things like newsletters out. But you can see it really makes a difference to have this big team. And thanks so much to all of our team members for all their assistance in these efforts. So with Excite, we had two basic projects. The first one, which we might have called A1 in the poll, is what we call Vaccinate with Confidence. It was non-competitive funding for 1 year, starting around April of 2021. And then we also have the pilot projects on adult immunization education, which was competitive funding, and we're just in the middle of that project. So today we're going to focus on Vaccinate with Confidence. And here's a preview. We'll probably do another program center stage on our pilot projects later as we get closer to the end of those projects. But as we are 1 year in and basically wrapping up our Vaccinate with Confidence programs, wanted to tell you what that looked like and all the great work we've been doing. So we had major goals to decrease vaccine hesitancy, particularly among our rural and what CDC kind of calls broadly the medically underserved audiences. So those became our priority populations, and we wanted to increase connection and communication between priority populations and healthcare systems. So for those of you not so familiar with cooperative extension has traditionally been in the agricultural school, doing a lot of things like nutrition education and sort of wraparound services that are towards healthy living and lifestyles, but not actually providing healthcare. So as part of Vaccinate with Confidence, we really wanted to do with our healthcare partners that could, for example, in this case, provide vaccination to folks. We really wanted to join forces and get our work out there and draw on the strengths of both of these groups. And so then the final goal, of course, was to increase these priority populations' access to adult vaccination. And it started with, COVID-19. With the pilot programs, which we're not talking so much about today, we are going to also include other vaccinations, but Vaccinate with Confidence, these education programs just focused on COVID-19 vaccinations for adults. So what did it look like? So we had 72 of our land-grant institutions, basically about 2/3 of them sign up to join us in this effort. And we had folks from all 6 regions, including our 1890s and 1994 institutions. So 1890 institutions are those who are historically Black colleges and universities, and we call 1890 because that's when the federal legislation recognized those schools as part of the partnership. The predominantly white institutions are sort of 1862 institutions. We also have several geographic regions for those. 1994 institutions are our tribal colleges, and so those partners were recognized in 1994 legislation over 100 years later to be part of Extension. But we were really excited to have folks from all of the regions, and including the territory of American Samoa. As you may imagine, some of these institutions are much larger and more resourced than some of these programs, like American Samoa. So we really did our best to try and get everyone involved. We've learned a lot about it, and are excited, hopefully, to continue this work and get even more institutions involved in future efforts. And so then back to this priority population, we had each institution choose based on what they needed in their area. So they had populations such as agricultural workers, faith communities, people from low resources, our tribal communities, simply rural communities in some states we knew were just not getting access to vaccinations. And then, of course, communities of color were another focus for some schools. So as I said, all geographic areas, we had about 48 of our projects. Again, nearly 2/3 were serving folks of Hispanic or Latinx origin. That included some of our migrant farm worker populations. And then you can see also across our projects, some of them served more than one of these populations, right? So quite a number again of Black or African American populations, our American Indian Alaska Natives, and then 13 of the projects were on 17 different Native American reservations. We also had folks focus on college students, some worked with extension personnel, also faith-based communities and healthcare professionals. Are you all seeing, is this in the way, these controls? Do I need to show
No,
you?
we don't see anything, Katie.
Okay, thank you. It's just me then. All right, great. So again, each institution chose where they wanted to focus based on the greatest needs that they identified in their areas. So if you think about this, we were onboarding people around, February, March of 2021, vaccinations were just becoming available. But we'd had a full year and we had a little bit of rollout starting in December of 2020. So around this time, we were starting to see who was really getting left behind. So it was kind of opportune timing to really focus in on some populations that we had, really good relationships with, or that we and our healthcare partners could serve together. So we used a few things to indicate whether we were actually making progress as we wanted to. Basically, partners, engagement activities, reach, meaning how many people we thought would have been accessing our content, and then the actual educational products and assets. And I'll show you some of those towards the end. And so, the whole goal was to work together with partners, create activities or educational products and share them with these communities that needed it, hopefully encouraging them to be more confident about getting COVID vaccinations and knowing where they could go to access them. With Vaccinate with Confidence, we did not actually provide any vaccinations as a requirement. So some and most of our campaigns, most of our projects were strictly educational. Again, a little preview for our pilot projects. We did start to be able to provide some vaccinations with our partners, but for Vaccinate with Confidence, it was strictly the main goal was to get educational products out tailored to our priority populations and really designed to overcome their hesitancies and work with them to build confidence. So here is a really, exciting, sorry, so sensitive, a really great showcase of all of our products. We call it the Excite dashboard. And you can see here the website you can go to look for the projects in your state and at your institutions are all on this website. And you can see, I'll walk you through a little bit of what you've got. So for this COVID immunization education, those are the Vaccinate with Confidence projects. So across those 72 institutions, we have reached almost 10 million people with those products alone. And that includes things like social media, Pandora ads, television, newsletters, all kinds of different formats. But they were, reaching a large number of people in these various priority populations. And so then if you choose with the second arrow on the left, any given state or institution campaign down here, you'll see that it'll pop up and tell you exactly how many for that particular campaign. So Alcorn State in Mississippi, one of our 1890 institutions, had almost 100,000 people that they reached. And then one last thing you can see down at the bottom of the window, these are the program details that are shown. You can also, if you see this spotlight video, you can click over to that tab and see a short video of what they've learned through their projects. Some of our partners that we've got, you can see a whole bunch of different partners, everything from public health agencies, which are like your county and state and local health department, to actual healthcare providers. Some of our institutions had schools of public health or medical schools, but some of them partnered with other outside hospitals, things like that. We had education and youth development organizations, and then just a whole host of other kinds of partners. So from the partner side of things, we really were doing an outstanding job as well. And then a quick look at some of our assets. And again, at the bottom of this slide, you can see if you go to extension.org/registry, registry is what we're calling our repository of these assets. And you can see here on the left, this is an example from the University of Wyoming, and that's the messaging they developed. You can see they have testimonials from some of their folks. Up here at the top in Spanish, this one is from the University of Maryland and University of Delaware as a combined outreach product. In the upper right, you can see people are showing how to read a COVID test. And this is from Oregon State University. Moving down to the lower right, Vaccinate, Immunize, Protect. That's the University of Florida and Florida A&M University joint messaging campaign. You can see they've got some FAQs, contact information, a QR code for a mailing list. And then here in the lower middle is from New Hampshire. Again, a different kind of message that they developed and sent out with their partners such as North Country Health Consortium and the North Country Public Health Network. So I encourage you to go and look again at the registry to find some of these things that, again, you might be able to adapt for your own programs, or even just to see the multitude of different things developed through this project. Okay, so I am going to check and see. I don't think we had any questions. And so then I will turn it over to Carl. He's going to tell us a little bit about our next segments.
Thanks, Katie. Appreciate it. And it's great to see everybody here. Hope you're having a great kickoff to your week, and we appreciate you joining us here. Okay, so as Katie mentioned, the Excite Activity 1 project was a 12-month program that teams from all over the country joined us in. So now that you've seen a little bit of the macro level of Activity 1, next we're going to hear from a couple of teams to get more about the micro level of the impact that they had. And I say micro level not to say that their impact was small, because it was not. But anyway, so we're going to start off with our team from the University of Wisconsin-Madison, and they're going to introduce their teams as we go. Each team will have 10 minutes. Please write down your questions, and we'll have Q&A after both teams present. Okay, Wisconsin folks, take it away.
Great. Thank you so much, Carl. Let me go ahead and get my slides ready for everyone. Perfect. Well, good afternoon, and thank you so much for inviting us to share more about our Excite COVID-19 Vaccine Outreach and Education campaign in Wisconsin. My name is Emily Latham, and I am joined today by my colleague, Angela Hahn. I would also like to recognize our other team members who are incredibly important to our project, including Amber Kanto, Brett Shaw, and Udayi Olivares. Now, when we first started considering what COVID-19 vaccine outreach and education would look like within UW Extension, we knew we needed to provide Extension educators with the knowledge and skills to be able to communicate about the COVID-19 vaccines locally. So with that in mind, we hosted a series of webinars with UW-Madison experts, and they were geared towards individuals and community-based service agencies and organizations who play a role in communicating about COVID-19 vaccines in local communities. The first webinar covered vaccine technology, development, and distribution, and the second webinar focused on strategies for communicating about the COVID-19 vaccines. These first two webinars were aired in English and had live simultaneous Spanish language interpretation. Recordings in English and Spanish are linked from our website that you see on the slides. And then the third webinar was specifically for Extension educators, and we were joined by a colleague from the Wisconsin Department of Health Services who provided a communication framework and key messages about the vaccines. Now, in order to develop a strategic plan for our COVID-19 vaccine outreach and education campaign, we brought together a group of Extension colleagues representing all Extension institutes and our area Extension directors, and we formed a COVID-19 vaccine response work group. This work group met bi-weekly starting in March 2021, and the initial purpose was to guide development of our outreach and education efforts, really leveraging Extension positioning as trusted messengers with select community partner groups. A 7-phase strategic communication plan that was based on frameworks developed by the CDC and NIH informed our entire process of building the campaign. And in the first phase, the work group engaged in a community partner mapping process. And this was to understand who Extension reaches as trusted messengers, with a specific focus on groups who are currently eligible to receive the vaccine and groups disproportionately burdened by COVID-19. And through this process, we identified rural farmers, farm owners, and farm families, and migrant, seasonal, and our immigrant farm workers as priority audiences for COVID-19 vaccine outreach. Once priority audiences were identified, the next step was to engage community partners. And we did this through one-on-one meetings and existing work groups and committees. This provided us the opportunity to learn what other organizations reaching the same priority audiences were doing and talk about successful messaging, outreach strategies, and think about potential gaps that Extension could fill. The next phase of the campaign involved development of communication resources and outreach materials that were really tailored to specific audiences and preferred communication channels. So we developed a COVID-19 vaccine resources webpage that includes FAQs in both English and Spanish. We also developed and shared an education and outreach guide for Extension educators. We had infographics that educators could use, flyers, and sample press release language in both English and Spanish. We also shared weekly posts from our Health and Wellbeing Facebook page. As the eligible audiences for vaccines expanded to include youth ages 12 and older, we hosted a virtual town hall for youth and their parents, caregivers, and families. Pediatrician and public health experts joined to answer questions about the vaccines for youth. And this town hall offered simultaneous Spanish language interpretation as well. But we also recognized the need for more resources that were specifically developed by and for a Spanish-speaking audience. So through a partnership with a local organization, the Latino Health Council, we facilitated another statewide virtual town hall for parents, caregivers, and families about the COVID-19 vaccine and how to keep kids safe. And this event was live streamed on YouTube in Spanish. Now, in addition to our Excite funding, we also partnered with the Western Wisconsin Public Health Readiness Consortium, who received a Wisconsin Department of Health Services grant. And together we provided a direct mailing to our agricultural partners and placed newspaper advertisements. Now, complementary to this effort, we also launched a Facebook ad campaign. So I'm going to turn it over to Angela to talk more about our Facebook ad message testing.
Hello, I'm Angela. So in Wisconsin, while approximately 2/3 of eligible adults are vaccinated, about 1/3 are not. And vaccination rates are also significantly lower in rural areas where there may be unique concerns. Rural populations and those who are politically conservative may be disproportionately affected or targeted by misinformation. Additionally, over recent years, social media has become prominent. Specifically, Facebook is the largest social media networking site in the world, and Facebook may provide relevant health information and shape users' decision-making regarding their health. Thus, our goal is to increase COVID-19 vaccine uptake in rural Wisconsin by providing health information to guide Facebook users' decision-making through paid targeted ads. Our target population is adults 18 and older in rural Wisconsin. So there were 18 Wisconsin counties included in the initial campaign with a primarily rural audience. The audience reached was a primarily white, older population, and we used 3 primary message frames across 3 consecutive ad tests. We ran these 3 different ads against each other to determine which message frame might work best. We looked at doctor testimonials, since research found many wanted to hear about COVID vaccines from doctors, and all doctors picked were from rural Wisconsin communities. We also looked at testimonials from other citizens, since storytelling and relatability with people like me might have been an effective message frame, and all citizen testimonials picked were from leaders in the agricultural sector in Wisconsin. And we looked at science, since scientific health-based information validated by peer-reviewed research might have also been an effective message frame. We spent $708 per ad for a total of $6,374 across 9 ads. We ran these ads through a time frame of November 12th to December 2nd. And our call to action was to drive traffic to the FAQ page, which is our extension website that helps people learn more about COVID-19 vaccines. So here is an example of a doctor ad, a testimonial ad, and a science ad. These are ads that are representative of their respective ad category, whether that is doctor testimonials, citizen testimonials, or science ads. They are the top performing ad based on cost per link click for their respective category, which is a metric I will get into next. So in this table, we examine the average of data indicators in each ad across ads, whether that is science, doctor, or testimonials. So impressions are the number of times our ads are seen on screen, and reach is the number of times people saw our ad. And looking at the total number of impressions and reach, science had the most impressions and reach, followed by testimonials, followed by doctors. Testimonials had the greatest number of link clicks, leading to our FAQ page, followed by science and doctor. Link click-through rate is the percentage of times people saw our ad and performed a link click to our FAQ page. Testimonials also had the highest link click-through rate, followed by science and doctor. So cost per link click shows how much on average each link click costs us. This metric is calculated as the total amount spent divided by the number of link clicks. Testimonials had the lowest cost per link click at $1.58 compared to $1.73 for science and $2.69 for doctors. So in looking at these data metrics, testimonials had the highest engagement with the best metrics and may have had the greatest engagement due to efficacy in storytelling and relatability. Doctors had the least engagement, which may be due to mistrust in the medical system and in authority figures. Science ads were found to have a greater engagement if the ad was timely. So most of our comments were negative, indicating that increased engagement may not necessarily be a positive thing. However, the number of people providing comments overall was small. In the context of reach, only 0.16% of people left any comment, and only 0.13% of people left a negative comment. And emerging research shows that comments override the message of the campaign, and so having negative comments run across your ads through time might dampen your campaign. Thus, we decided to hide our comments, which was a topic of great scrutiny and debate in our team to this day. We also looked at other forms of engagement, including shares, reactions, and link clicks. Science had the highest number of shares, and reactions had the highest number of reactions and link clicks. So these findings also bring up the issue that different ads may elicit different outcomes and methods of engagement. There are also additional opportunities for the future and next steps. If we were to continue to do digital ad campaigns for COVID in the future, we may wish to be more specific in our target population. For instance, this may include targeting only Spanish speakers or parents with children. Additionally, we can adapt our methods of handling comments by giving people an avenue to ask us questions about COVID-19 and vaccines on our FAQ page. All right, thank you all for listening. Do you have any questions?
I know you do have some great questions, but just kind of keep those under wraps. If you wanted to, you could put those in the chat. We'll make sure that we keep an eye on those and address those at the end. But for now, let's move on to our team from Clemson University with a big thank you first to our team from Wisconsin. Thank you, guys. Clemson, take it away.
Great, thank you. Thanks so much for inviting us to come and share our project that we've done here in South Carolina at Clemson University. We put together a pretty large team. The team is, spread across several program areas in extension, as well as a couple of colleges. And so, I will go ahead and introduce sort of who those are. So this is the team. It's important to highlight Dr. Kathleen Cartmell. Dr. Kathleen Cartmell is an expert in vaccine hesitancy in lots of different kinds of vaccines. HPV, I believe, is one of her target areas. And so she was instrumental in helping us to identify some of the strategies that we took as we prepared our interventions and messaging. Danielle McFall, she is a member of the Rural Health and Nutrition Extension team. Mechi Rossi is a postdoc, and she's in the Food, Nutrition, and Packaging Science Department. Dr. Ashley Burns, she is our 4-H program team director. Dr. Matthew Burns is our division director for Ag and Natural Resources. And Dr. Nathan Smith is our program team director for agribusiness and also in the Department of Ag Sciences. So an overview, our project goals when we set out were to really provide evidence-based information about COVID-19 and COVID-19 vaccines. We looked at media campaigns, print and electronic materials. And the second goal was to really try to better understand the barriers in our target population to reduce COVID-19 vaccine hesitancy. Our target population was in general the rural communities in South Carolina, as well as Hispanic communities as a secondary population. So it's important to highlight that we already had some activities happening in South Carolina around vaccination testing and vaccine clinics themselves. We have a very strong partnership with the Medical University of South Carolina. And so we worked very closely with them. We had been doing that since probably July, July of 2020. I see the date. Thank you, Danielle, for adding that. So since July 2020, we had started working with MUSC. Extension's role was really to go into our communities, our rural communities specifically where resources were limited, work with identifying a point of contact, typically at a faith-based organization, and then promoting and marketing these vaccine testing, these COVID testing clinics and vaccination clinics. In the end, we ended up testing over 9,000 individuals. That number, we're still doing this, so that number is growing. We've vaccinated almost 2,000 individuals with 184 clinics to date. So this just kind of gives you a timeline. We met initially as a team and we talked about, what our next steps were going to be. So in May, the project started. We identified that we wanted to do some focus groups with our Hispanic population. So we began with focus group planning, recruitment strategies with identified community partners in target counties. Then we started the actual focus groups starting in August 2021. Those focus groups included an educational component. So we collected information before we collected the initial information. Then we provided some education to the individuals enrolled in those focus groups. And then we evaluated them after that education. Then I won't go into detail. Then we did a social media campaign on Facebook. We also did outreach with South Carolina Living Magazine. That magazine targets rural communities in South Carolina. November 2021 is when we developed an Excited about COVID prevention. And that was a resource guide developed for 4-H. And so that's one of the things I know that they were interested in us talking a little bit further about, and we'll do that. So I'm going to kind of stop there with the project timeline. And let me just do the last thing was that we did a mass media campaign with billboards and newspapers. And so we identified specifically where we have intersections of, interstates in our state. Those typically are in rural communities, rural areas in the state. And so we specifically targeted those and we put billboards up and ran those campaigns for a while across billboards. We've actually found that to be very impactful. So I'm going to allow Danielle to go on now.
Okay, so now that we've seen kind of an overview of the project, kind of looking a little bit more in depth to our internal and external outreach efforts. So prior to the Excite project, that's where we actually started some of these efforts for internal outreach. So Extension leadership hosted a series of COVID town halls, provided updates and guidance surrounding protocols for program delivery and office operations. And then as we started into the actual Excite project, we started understanding a little bit more about how we actually needed to provide some education to our faculty, staff, those who are actually trying to reach the target populations. Some of the basic messages at that time, so the fact that COVID-19 vaccines are safe, that they're effective, and that they're free, those were some of the primary messages. But what we were kind of hearing from extension agents and others that would be working in these target populations, they needed a little bit more than those basic messages. Actually, to understand a little bit more of behind the science of the how and the why that COVID-19 vaccines are safe and effective. So from there, working with leadership to actually implement this COVID-19 Lunch and Learn webinar. And I've got some numbers for individuals who attended that webinar. And so that was hosted with local experts, so including local physicians, nurses, and even some Clemson researchers to help explain more of the details of the how and why. So other university-wide presentations and email distributions were also used to try to provide evidence-based information. Also hosting other extensions specific program team meetings to provide direction for hosting safe events and camps as we learn more and additional guidance from the CDC. So the internal outreach that we want to highlight today is really looking at the collaboration work with 4-H. So our team developed a 4-H activity and resource guide. And so that's a collection of educational resources that were adapted from other evidence-based sources that's intended for educators and families. So these packets included resources for facilitators about COVID-19 and about COVID-19 prevention. So a lot of these resources coming from the CDC. Then the rest of the guide is split into different activity groups based on age. So we had a 1st through 3rd and then a 4th through 5th age group. And each of those groups had age appropriate videos and accompanying activities to help the facilitator, whether that be a 4-H agent, a 4-H volunteer, other teachers, or even parents that were doing these lessons with youth. So some of the interactive lessons, especially with the 4th through 5th grade, included a DIY soap and then a glow germ activity for hand washing. So each of these activities correlated to educational standards. So with this packet, we actually distributed about 200 of these packets to 4-H agents and designated volunteers. And then additionally, some agents were also able to receive a glow germ activity and the supplies to actually aid in that facilitation. So external outreach efforts, these focus mainly on reaching our initial target audience. So again, those unvaccinated Hispanic individuals living in rural communities. We worked with our community points of contact for accessing these target groups, identifying when's the best day, best time of day to schedule these different groups. And then later, we really relied heavily on these points of contacts for distributing surveys related to attitudes and beliefs around COVID-19 vaccination and vaccine hesitancy, which we'll talk about a little bit with our opportunities for improvement. So this helped to extend our reach into the target population. And as mentioned before, the 4-H guides were then also distributed as well externally, including those volunteers. And so then lastly, with the external outreach, we also use different media outlets to help combat misinformation, to share evidence-based information. This included some fact sheets, social media posts, the magazine articles, and even with the social media, we actually took some clips from that Lunch and Learn and then targeted those based around the fall when we were seeing some additional surges for different waves to try to target kind of very timely posted social media. And then even recently with our billboards and newspaper ads as well. Okay, so a little bit about our reach and outcomes. So we've mentioned a little bit about some of the different educational materials that were used as part of the focus groups, our fact sheets and all those different things. That's all listed there. And the first bullet point, so these materials were developed in both English and Spanish. Here's where we have our distribution of our excited about COVID prevention packets. We also use cue cards, and this was actually a benefit of being a part of the Excite team. Another institution actually developed these cue cards to help agents. These are not community-facing cue cards, but these are actually extension agent-facing cue cards to help combat COVID-19 misinformation. So these were distributed to many of our agents who would actually be in the community working with individuals who might have questions or might have heard inaccurate information about COVID-19. And then also just to highlight, there was another presentation that was actually delivered about COVID in rural communities. Okay, so our focus groups actually reached 23 individuals. And then that's where we actually identified the need for expanding that reach through surveys. So going back to those points of contact, having them to distribute these surveys through WhatsApp, through social media like Facebook, and also email distribution lists. The webinar, so that's that Lunch and Learn webinar. That's where we reached 148 individuals, that's extension, and also Clemson University faculty and staff. And then here we see a lot of our larger reach coming from our social media and print, as well as our mass media, so this being billboards. Oops. All right, so lessons learned. So starting with strategies for success. First, it was key to educate the employees and staff before trying to reach the target population. And then next, kind of what we've heard from others, and if you're familiar with Extension, was partnerships. So not just our community partners, but also partnering with other program teams like 4-H, and even across colleges to help to extend our reach. So what I kind of mentioned earlier about the importance of working with our community stakeholders to extend that reach. So jumping over to opportunities for improvement, we were really struggling with the focus group recruitment. It was a difficult time, some politicized messaging around COVID made it really difficult, especially with our target population, to be able to reach them. So in order to extend the reach and in order to safely extend the reach, because again, we were combating different waves of different COVID strains as we were trying to implement these focus groups, and we could not implement the focus groups virtually because again, we're targeting individuals in rural areas where broadband is not, might be a good alternative in some areas, but would not have been a viable option here. So using those community partnerships in order to extend the reach so that we were able to actually still have a good number of individuals to respond with information about what they believed about COVID and what they believed about COVID-19 vaccines to extend our reach. So then looking back to some of our strategies for success. So other partners, so Dr. Parisi's already highlighted Dr. Cartmel being our expert, some existing research that has been done with vaccine hesitancy. So then being able to translate that to what we were working on specifically with this project to help kind of keep us from starting from ground zero. We were able to just adapt some of the things that she had learned along the way. So looking again at community contacts, so really highlighting the importance of those community contacts knowing our target population. So knowing that we really needed to have some evening focus groups because that was going to be the best time to actually have the most participation in some of our focus groups. And then lastly, over for opportunities for improvement, as it's been mentioned a little bit before, watching the ads on Facebook, the different posts, having to monitor those for the comments. We also had some very similar discussions around how to handle those situations, because we know that we don't want some of those that misinformation being added to our posts. So being able to also hide those comments. So those are some of the things that we learned to be implemented for the future. So now I think we're going to turn it over for questions, and we appreciate you listening to our presentation.
All right. Thank you so much, Clemson team. Let's give them some love for their presentation. Thank you so much to both. And now you guys have been so patient in receiving. It's your turn to open your mics, add something to the chat. What are your curiosities and questions at this point? Let's see, Clemson, we have a couple questions for you in the chat already. Dr. Clemmy asks, was there a multiplier effect of the reach numbers from that Clemson cited, that you guys cited?
Likely, but we don't have that. We basically just took the total clicks, the total reach that were provided from the social Facebook social media, and we kind of extrapolated from that. So that's where we got those numbers.
And also the total reach for the magazine. We also know the total reach, the projected reach for the billboards and those sorts of things as well.
Okay, great. And then Katie answered Emily Barber's question in the chat, which is important for everybody. You want to see those cue cards and other assets from all these teams, you go to the registry. There's a ton of stuff in there that you can see and check out. So, all right, so there's that. All right, what other questions, curiosities do you guys have? Put in the chat, open your mic, ask.
While people are thinking about that, let me answer the other question from Dr. Clemmy about cross LGU partnerships. Yes, we absolutely have several different types of cross LGU partnerships. More of those were in the pilot projects, the competitive funding, but I believe Michigan State and two of their Keweenaw Bay and Bay Mills tribal colleges did a really great partnership. So I encourage you to look them up in the registry and see their video through the spotlight video part of the dashboard, or look at their assets in the registry. Definitely had some 1862s and 1890s working together. I know because I'm on the UF team, informally we were working with Florida A&M University for A1, in that we kind of took several different counties in the Panhandle and focused on them based on our own sort of geographic reach, if you will. So counties that were very close together, but we each took a few and had very similar messaging, because the priority population in those counties was still our rural Black folks. So yeah, I think there were all sorts of different kinds, and I think that was one of the highlights of this kind of system work. You heard both of our teams, and I swear I didn't, ask them to do this, but they talked about the ways that they were using things across projects, across different funding sources, across their partnerships with healthcare folks. And so I think that's really the strength of these efforts. So were there other questions that came up so far?
I'll just add, Carolina, that, to some public health individuals might think this is surprising, but we had about a third, 30 to 40% of our eligible adults were not vaccinated at the time we started this project. So there was a very different political climate, I think, in South Carolina, and we recognized early that our own system, our own extension system, was part of that. So it became really important to pull in Dr. Burns, Dr. Smith, Ashley, both Dr. Burns, and just make sure that we had that buy-in from the extension system overall, because that was kind of an interesting lesson for me. I think I assumed vaccinations are coming out, everybody's happy to know that, and everybody's going to get vaccinated, but that's not the way it worked. And Dr. Cartmel was also just instrumental in helping us to kind of identify how to reach and identify those barriers. So the team was essential from a Clemson standpoint to really be able to kind of address a mixed methods approach to kind of getting information out.
All right, we just had a question come into the chat.
Great. So Maddie, I think is how I say it. Thorburn, maybe Dr. Thorburn. How have you trained and prepared teams to communicate science-based information? I'd like to hear more about the webinar. So was that directed specifically at South Carolina? I think you all were talking about an internal set of stuff at the beginning.
So do you want, should we?
Go ahead. I mean, either of you, if you both did one, absolutely. Oh, Emily, you're still muted.
Well, and
I think we both did, but Michelle jumped in.
Oh, yeah, go ahead.
No, go ahead.
So yeah, we did a webinar, and Dr. Matt Burns was instrumental in that. He created or he worked on a collaboration with a physician at ANMED, which is one of our medical partners. And it was really important because in extension, we're all science-based, so people need to hear the science. So beyond just the message, they needed the science, and that's what we identified, kind of quickly. And so that webinar was a big part of it. We also did town hall meetings, and we did our, excited about COVID prevention through 4-H, and that was presented to 4-H extension agents. We did a lot of internal educating, and then those snippets, those webinars were recorded, and we condensed them down into smaller fragments. Those were added to our website. And people were encouraged to visit the website for that kind of information.
And I'll share, so our approach was very similar to what Michelle just described. So we started off with a lot of education for our colleagues as well. And I mentioned a couple of our different webinars. One, we invited in a AAW medicine professor who specifically focused on communicating science. They gave us some of the research and successful strategies for talking about science communication. And then we also did another kind of internal train the trainer, where DHS, the Department of Health Services, joined to give us a framework and then really concrete key messages that our colleagues could use. So similar in terms of the vaccine is safe, it's effective, here's research, here are some talking points and ways to address some common misperceptions as well. And I will say it was similar as well in Wisconsin in terms of finding that, talking about vaccines was really new for our colleagues. And of course, we know the COVID-19 vaccine was really politicized, and people had a lot of hesitancies around just even engaging in these conversations. And so we did some both short-term and long-term evaluations of those webinars that we led to really understand what about them did they increase colleagues' confidence in the short term to have these conversations, and then long term did they lead to more community engagement? And we found that yes, they increased confidence, and long term, it was still kind of hard for colleagues to find their footing in terms of direct engagement. And that's why we ended up making a lot of these materials at the state level, so colleagues could share, a flyer or direct people to a town hall where, again, some experts could get their answers answered by experts. And so having these resources available that our colleagues could share locally and turn people to who may have more questions about the vaccine.
Well, thank you so much. I'm afraid we're out of time. We had some great questions come into the chat. I hope we got those answered briefly. Mary said, did we create a database of potential partners? Oh, okay. Did either of you, Emily or Michelle, did you have a database of potential partners?
Yeah, so back in July, when we partnered with Medical University of South Carolina, we asked all across the system to provide potential points of contact in all of our rural communities, and send us potential points of contact. So there were a lot of faith-based, and then, like I said, we reached out to our medical partners to actually ask them to provide the actual clinical services that came along with our connection. We connected them in the county, and then the medical partner came in and actually provided the clinical services.
And we have an internal spreadsheet where I've been collecting different partners specifically that we engaged at the state level, but our county colleagues did a lot of connection to partners at the local level that I don't think we have represented on that spreadsheet as well.
All right, we had one great question or two for both of you come into the chat. We're going to wrap it up with a 20-second, you get to answer each of these as quickly as possible. So Michelle and Emily both, what was your favorite way to reach and educate unvaccinated, to persuade them possibly? And two, what strategy do you think needs the most tweaking for those who are hesitant? So rapid fire answers, whoever wants to go quick. Favorite and most tweaking. Oh, you're muted, Emily.
This is such a hard question to answer so quickly. I think for me, favorite would be the town halls. It was great to have those experts right there. People can ask questions in real time, and to be able to have that simultaneous Spanish language interpretation was key. And then I think tweaking, we shared a lot about our Facebook ads, and I think we learned a lot. And then we've actually run ads since then and done a lot of tweaking. And I think it's ever evolving in terms of shaping those messages to be able to reach people through social media channels.
Awesome. Michelle, favorite and tweaked.
Favorite would be our webinars and, targeted to our extension agents and our 4-H activity project that we targeted toward 4-H agents. And I think we all found out very quickly that social media was a little dangerous. And so we learned that, and we learned how to hide comments and just try to continue to move forward in that messaging.
Thank you. Thank you. Thank you both so much. Thank you to Kelsey, who has asked us to do a quick 1-minute feedback survey in the chat. Thank you to Carl for my co-host duties today, Melanie for our tech support as well. Thank you to both of our teams who I swear I didn't ask to talk about really similar audiences, but in 2 different parts of the country, but with very similar and yet different approaches. And I will say that other teams did not have the success with billboards. So I really, really love this, the system level work to look at things that work really well in your area and things maybe that don't work so well. And, the similarities with social media, but the different approaches. And I'm just so grateful for these teams who, let's not forget, did all of this in the middle of the pandemic, probably trying to get vaccinated, many of them themselves, their families, their teams, people were out, and it's just really incredible work. And I thank so much everyone for being part of this. Kelsey also reminds us we do this once a month. There will be different topics going on over all of extension work. And so I encourage you to come back in a month and see that. And like I said, we will be back for one on our pilot projects in 6 or 8 months or so, whenever they can get us back to share a little more. Please follow us, join our newsletter if you like. Don't hesitate to reach out if you have any more questions. We're happy to send them on to the teams. I really appreciate all the great questions. Kelsey, do you need to say anything else? Because I know I took much of your time.
No, you're good. You covered it. Thank you, Katie. And thank you, Carl, and all the teams for informing us. I'm sure we all took something away from that. So like Katie said, just fill out that 1-minute feedback survey. It just kind of helps us better understand how we can improve our next program center stage workshop. So with that, you guys, I hope you all have a great rest of your Monday, and feel free to reach out to either me, Katie, or even Carl if you have any questions. Have a great day.
Thanks, everybody. Have a great week.
Did y'all send the recording out? My internet kept going out.
Absolutely.
It was not stable.
Absolutely. We will send the recording on the slides for you, for sure.
Bye, everyone.
It was not stable. Thank you.
Yeah, take care.
Thank you.
Yeah.